Hi, my patient is an actual patient of mine, a female patient with a hormonal imbalance. The reason for her visit was that the doctor referred her to see me for a weight loss diet. She's a 55-year-old female. She's 5'3". Her current body weight was 175, her BMI 31. Her usual body weight is 155 pounds. Her menstruation ceased at age 51. She's now 55. When she came to me, she complained of unintentional weight gain of about 20 pounds in the past 6 months or so, and she's unable to lose weight no matter what she did. Any diet she tried, exercise, she really didn't lose any weight. She also has gastric issues such as bloating and cramping, which she said it's especially after eating meals, sometimes before meals, and she feels a lot of bloating at nighttime. She's been experiencing night sweats, some hair loss. Her skin seems pretty dry, and she gets a random itchy red rash on her torso. She also has hot flashes, especially when she's under stress. She also complains of frequent headaches, which she did not have prior. She recently was diagnosed with anxiety and depression and feels like she has social phobia and brain fog, as well as memory issues, since she tends to forget things. Her history of her illness and medical history: she has elevated blood pressure, but she's not on any medications. Her cholesterol is also elevated. The doctor gave her Lipitor. She was recently diagnosed as pre-diabetic due to elevated glucose and A1C, and now she's in the obese category. Her past medical history is not very significant. She has a tonsillectomy at age 13. She suffered from premenstrual syndrome, as stated by her, and she did have preeclampsia with her first child. She had an induced birth, and it was vaginal at 28 weeks. As far as allergies, she does have environmental allergies such as hay fever. She's allergic to cats and dogs. She believes she may be allergic to wheat and gluten, and she does state that she is sensitive. She did ask her allergist to test her for food allergies, however, he refused. She's not sure why. These are her medications and supplements. She's taking Lipitor. She herself self-prescribed Tylenol PM, which she takes every night. It started because of her headaches, and then she said she can't sleep well. She didn't complain of insomnia, though. She also takes a generic multivitamin once a day when she remembers. As far as her recall, it seems as if she's on a standard American diet. She tends to dine out a lot, at least 6 to 7 days a week. On the weekdays, she skips breakfast because she's running to work, and she buys a salad or something like that for lunch. She might snack on fruit or chips. She likes dark chocolate and nuts as well. On weekends, she randomly snacks all day on items such as fruit, chips, nuts, chocolate. She doesn't really have a regular meal time, and sometimes she tends to have pizza, sushi, maybe a burger, and she dines out at least for 2 meals every day. Her family history includes her father, who passed away at 73 years. He had diabetes, heart disease, and gastric cancer. Her mother died at 89 years of age. She had diabetes, hypertension, hypothyroidism, dementia, and the dementia was diagnosed as Alzheimer's. She has a daughter and a son who are both healthy. She is not sure about any other family history. As far as social history, Her work hours tend to be very stressful, about 12 to 16 hours per day, and she does work every other weekend, 12 hours on a Saturday and Sunday. She's married, and her children are aged 28 and 27. She doesn't really socialize much due to feeling depressed most of the time. She's been married for about 30 years, and her main stressors are her work and the fact that her husband recently lost his job, and now she's the sole supporter. This is what I found on a nutrition-focused physical exam. She did have high blood pressure, heart rate was normal, some hair falling out, dry scalp a little bit. She does have amalgam fillings, and her tongue looked thickened and scalloped. She did have a red rash on her torso and seemed to have dry skin. Her abdomen was bloated, obese. Her hands and feet were cool to the touch. These are basic labs that I recommended and the doctor ordered in the conventional clinic, since dietitians cannot order labs in New York State. Her cholesterol was 240, which the doctor started her on Lipitor. She had high blood pressure, but it was 140 over 90, so no meds were started. Her LDL was high, her HDL was low, triglycerides high, fasting glucose was 130, and she had an A1C of 5.7, which indicates prediabetes, and a low vitamin D level. Interestingly, her thyroid levels were all under control, within normal limits. I told her to go to a functional doctor, which she agreed to. So the doctor gave her a ZRT saliva test, and these were the results. It seems like her hormone levels are a little bit out of whack. So her estrogen is low, progesterone low, testosterone was normal, DHEAS was low. Her cortisol was really high at night, which is interesting, and she did have a higher aluminum level. So these are the supplements that I would recommend for her. I would help her fix up her adrenals with Adrenavive, give her FemGuard instead of her multivitamin, L-theanine to help her possibly sleep at night, maybe fix her headaches. She could take sun chlorella to help detoxify the aluminum in her body, and also a vitamin D supplement to help her vitamin D go higher. The functional medical doctor also prescribed her progesterone and estrogen. So in summary, the patient, AL, is 55 years old. She's an obese female. She's in menopause as indicated through her labs, and her menstruation had ceased about 4 years ago. She came to me to help her lose weight, since she stated that she has a hard time losing weight no matter what she does, which is common in menopausal women. Also, she complained of her stomach problems such as bloating, cramping, especially pre and post meals, nighttime, and some hot flashes, dry skin, headaches, anxiety, depression, and brain fog. She does have high blood pressure, but it's trying to get under control through her diet and exercise. The doctor does not recommend meds at this time. She is taking Lipitor, which I'm hoping she can get off if we try to fix her diet and exercise and hormones. So she is pre-diabetic at this time and in the obese category. In the past, she's only had a tonsillectomy, but she did suffer with severe PMS, and she had preeclampsia with her first child. The family history is strong for diabetes and heart disease, and stress that she is experiencing may cause adrenal dysfunction. According to the Nutrition Focused Physical, it shows that there is possible hormone imbalances. Her high cholesterol could be part of the menopause as well as the prediabetes, and her diet is not very good, which also causes problems. So I would suggest a ketogenic diet to help stabilize her sugars to start with, and then I would transition her to a Mediterranean diet once her blood sugars are within normal limits. She needs to increase her fiber through whole grains, fresh fruits, and vegetables, and she needs to increase her cardio activity. I would suggest she gets clearance from her doctor before starting any gym routine, but for now she should walk at a moderate pace for about 20 to 30 minutes per day. She also would benefit from reducing stress by maybe deep breathing, meditation upon waking, and before going to bed. I would also suggest that she pre-plan her meals before going to work, maybe on the weekends that she doesn't work. Make sure she brings healthy snacks with her, such as fruits, vegetables, add nutrient-dense proteins. Instead of buying bottled water, I would suggest she get a purifier and drink water throughout the day. And I would switch her cosmetics, especially deodorant, to aluminum-free. She should practice the deep breathing, meditation, maybe take a yoga class, stretching, which would help with her stress and anxiety. I would also send her to an endocrinologist and some other specialists to follow up on some of her symptoms and maybe add some lab work. I would also suggest she go to the dentist to possibly change her fillings, and I would recommend that she come back and see me in about 2 weeks. Thank you.